really thrilled today to have Bobbie Boyer from the department opening the day for us. Bobbie is the Deputy Director for Prevention Services at the Department of Mental Health and Addiction Services. And that really, her role as Director of Prevention Services builds on a long career in the prevention world. Her prevention experience spans more than 4 decades with work in administration, strategic planning, program development, staff supervision and training, marketing, and community collaboration. She worked in a consultant role with a broad sector of community leaders from government, business and industry, schools, courts, churches, and community groups, with her work focusing on comprehensive strategies for the prevention, intervention, and suppression of drugs and crimes. So just as an aside, the kind of person you really want working for all of us in state government. I think she really exemplifies that so well. In her current role, Bobbie's responsible for managing the department's overall prevention efforts, which include making sure programming is aligned with priorities established by the governor's Recovery Ohio initiative, and ensuring that proven age and environmentally appropriate education is provided to Ohio's youth from kindergarten through 12th grade. Throughout her career, Bobbie has had many has led many collaborative preventive efforts locally, including the development of the Sandusky County Prevention Network. She was a founding board member of the Ohio Parents for Drug-Free Youth, now the Prevention Action Alliance. She completed a 6-year term of service for the Ohio Chemical Dependency Professionals Board in December 2018 and has served on the board's prevention committee since 2007. Bobbie holds independent licensure from the Ohio Counselor and Social Worker Board and the Ohio Chemical Dependency Professionals Board, along with the highest certification in prevention. We are just so honored to have her with us today to kick off the symposium and share some perspectives from the department regarding the challenges and opportunities before us. Bobbie was not able to make it down to Athens today, but we're going to be able to hear her through the miracle of Zoom. And at my age, you still find Zoom and those things a miracle. So thank you for tolerating an old guy. Please join me in welcoming Bobbie Boyer. Bobbie.
Does not sound good. Is this better now? Good morning. Thanks so much again, Director Leidy, for inviting our participation in this wonderful event. Currently, our department is partnering with Department of Education and the Appalachian Children Coalition on Workforce Development Strategies, and I look forward to what we will continue to accomplish together in the coming year. Also, it's such a pleasure to be here with our partners at Ohio University. Greetings to Dean Mark Weinberg and Dr. Holly Raffel from the Voinovich School of Leadership and Public Service. OhioMHAS has a very long history of work with OU. Although I'm the new person to this relationship, I credit much of our groundbreaking work in prevention to that partnership. Even though I'm coming to you virtually, I'm wishing I could be with you there. What a beautiful setting for this fall day. In my role at OhioMHAS, I oversee the Office of Prevention Services, as Randy noted. And today I'm going to focus much of my presentation on that work. In my previous role at the Institute for Human Services, I developed the training system for the Ohio START program and enjoyed working with many of you here today, including Sam Schaefer, one of your presenters. I'd also like to send greetings to Governor Taft and thanks to you and your lovely wife, Hope, who is a wonderful pioneer and advocate for prevention in Ohio. So this morning, we had a lot of technical problems, so we'll see how this works. I think I have 2 different PowerPoints up that I have to move in order to make this work, so we'll see how I do. I may have to switch over to a new thing midway. We'll see what happens. Anyway, the first thing I'd like to say is Governor DeWine's first action as governor was to create the Recovery Ohio Advisory Council. In addition to that, one of his first executive orders was to elevate the role of prevention, resulting in my role at OhioMHAS at the deputy director level within the department. That means that I sit on our executive leadership team and participate in decision-making for the department. Director Chris is a tireless advocate for prevention as a critical part of the continuum of services for every local community. Recovery Ohio is made up of a diverse coalition of leaders throughout the state, working together to enhance our understanding of the behavioral health crisis and how it impacts all sectors of society. I served on the first panel of representatives on Recovery Ohio Advisory Council, along with Governor Strickland, that I also see will be sharing later today. Here you will find a summary of the prevention recommendations that came out of the Recovery Ohio process. It includes things like the use of youth prevention surveys, expanding community coalitions, establishing prevention education in the K-12 space, promoting mental health in college campuses, and others. The initial document also included recommendations around our workforce needs, health promotion, stigma reduction, expanding the use of technology, access to care in rural areas, early intervention, and screening across the lifespan, and much more. Although this report was published in March of 2019, it remains a viable document that still guides our work today, not only in prevention, but across the continuum of treatment and recovery supports. Governor DeWine's expectation is that we're here to make life better for Ohio families. These are our closest state partners in the work I will share with you today. I like this picture because it really gives kind of an interesting take on the experience we've been through with COVID. The quote is, "We may all be in the same storm, but we're not all in the same boat." So each one of us have experienced COVID a little differently, depending on the kind of boat we're traveling in. So we know pre-COVID data indicated that youth were already experiencing more anxiety, depression, and suicidality. And after a surge such as this pandemic, it is normal to find an increase in behavioral health needs after such experiences. This slide gives you a picture of the different types of responses to disaster and pandemics. So the red bubble talks about distress reactions, which are things like sleep difficulties, decreased sense of safety, physical symptoms, irritability, anger, distraction, isolation. Those are the things that many people experience going through pandemics and disasters, and I'm sure you can relate to some of those. The yellow bubble indicates health risk behaviors, such as increased alcohol, tobacco, or prescription drug use, family distress, interpersonal conflict and violence, disrupted work-life balance, and restricted activities and travel. The blue bubble indicates psychiatric disorders that occur under long-term stress, such as depression, anxiety, PTSD, and complex grief. The resilience bubble is really the place that we want to focus on during this presentation, because we need to build resilience to protect against all those other risks in our lives. So in order to identify the critical challenges facing children in the Appalachian region, data is important to review. I know later on you will be reviewing data with Joan England and Tracy Nahara regarding the continuum of care. I would like to give you a brief preview of data that's already available to your region with student surveys. What better way to find out the needs of children than to ask them? The survey that I'm going to talk about today is the Ohio Healthy Youth Environment Survey. The purpose of OhioMHAS was to provide a free resource to all schools. It was started by another collaboration between the Department of Education, our department, and the Department of Health. Ohio University of Williamsburg School Leadership and Public Service has been our vendor in the development of the survey and maintains a key role in implementing the survey each year. OhioMHAS is free to schools, voluntary, anonymous. It's for grades 7 to 12. It's an online survey, quick 15 to 30 minutes, has 110 standard elements or 119 optional questions. It's administered by the schools, and parents can opt out if they would like. The content areas are noted here on the screen, and I'm sure many of you can't see them, so I'm going to just whip them off real quickly for you, but includes demographics, substance use, mental health and suicide, gambling, bullying, adverse child experiences, safety and violence, family and peer factors, community environment, school climate and safety, physical health and well-being, and also has some sex-related optional questions. The maps here indicate when we first started the survey in 2015, in your region, the counties that participated. The yellow counties are ones that had at least one school district participating, and the orange counties had 2 or more. So you can see across the region, across the years, there was quite a good participation in the Appalachian region. This slide gives the actual numbers of students and districts that participated in the survey. When it started, we had over 9,000 students in 29 districts, and the process was built that every 4 years there would be a real recruitment of new schools. So even in the interim years, there was still 3 to 4, we increased each year, and then 9,000 occurred in the 4th year again. So last year we had another push to survey students by my director. She asked that we do an extra solid push to see what we could learn as a result of COVID, the COVID experience. And we now have a 90-page presentation that offers a deep dive into the data in the Appalachian region that's available to you. And if you're interested, our team could share that report with you. A few highlights are here noted on the screen. Almost a third of students reported high anxiety, while about a quarter of students indicated high depression. And that was an increase over those from 2015 to 2020 and 21 by 7 points in some areas. Electronic vapor products were used and reported by over a quarter of the students. Approximately half of youth who reported drinking alcohol in the first month have binge drank at least one time or more during that same period. Among those that were bullied, more than 2/3 reported experiencing bullying through text or social media. And then a couple of protective factors to note are that more than half of students reported that they had a lot of adults in the community that they would talk to about something important. That's a really wonderful protective factor for your region. Most students reported feeling safe in their town and community, and that's up to 89%. So that's really amazing. These reports are available online. There's different reports that are available for the public, and also very particular reports for individual schools. Another report that was issued this year from the CDC shared data about an increase in suspected suicide attempts among US girls ages 12 to 17. The best way to protect youth is to build those positive social connections or bonded relationships. Those relationships can mitigate many risks. As we know, mental health continues to be a concern for young adults on college campuses as well. According to the World Health Organization, suicide is the second leading cause of death among young people aged 15 to 29. According to a CDC survey in August of 2020, more than a quarter of 18 to 24-year-olds reported seriously considering suicide within the previous 30 days. That was very alarming when we saw that. While 3/4 reported one or more adverse mental or behavioral health symptoms. In a report published this spring, researchers at Dartmouth College, who tracked the moods and behaviors of about 200 college students for 4 years, say stress levels are at their highest. I'd like to take a few minutes and just dive into some of the research that undergirds our work. One of the Bible, we kind of consider it the Bible of prevention, is as a document that was just produced in 2019 by the National Academies of Sciences, Engineering, and Medicine. This report was called Fostering Healthy Mental, Emotional, and Behavioral Development in Children and Youth. This report uses that language of mental, emotional, and behavioral health development. And we try to use that in our department as well. And it describes that development to be a product of complex neurobiological processes that interact with characteristics of the physical and social environment, beginning before conception and through and beyond adolescence. Healthy development is shaped by experiences and circumstances that cross generations within families and affect entire communities. This next slide is probably another one that you're not able to see, but along the bottom, it has the developmental stages of life: preconception, prenatal and infancy, early childhood, adolescence, and adulthood. And on the left-hand side, the mental, emotional, behavioral development. And the left arrow here points towards the influence from previous generations and families. And the right arrow points towards parenting the next generation. And the box in the middle are all the risk and protective factors and influences across this development that occurred at the societal level, neighborhood level, family, and individual level. This next slide describes the risk factors for suicide, gives you examples. And some of those examples of risk factors for suicide are history of substance abuse, physical disability or illness, losing a friend or family member for suicide, ongoing exposure to bullying behavior, having a mental health condition, recent death of a family member or close friend, and relationship problems. And last, access to harmful means. And on the left side, it shares the protective factors that we really try to build to protect against those risk factors. And at the top are, to me, the most important: parent connectedness and connections to other non-parental adults. So those bonded relationships with adults is one of the most important things we can build. School safety is another one. Closeness to caring friends and peers. Overall resilience at the individual level. Neighborhood safety and access to health services. Those are all protective factors that not only protect against suicide risk, but also other risky behaviors. Research shows that one of the key factors that helps children and youth overcome difficult times is the presence of at least one stable and committed relationship with a supportive adult. I'd like you to take a moment to think of one adult outside of your immediate family who made a positive impact in your life. Perhaps it was a teacher, a coach, a scout leader, a school counselor, or librarian. I know for me, I think about my second grade teacher who brought a kitten to me when I was out of school sick for a period of time. And I also think about my pastor who took me to the College of Worcester and helped me understand that I could get some financial aid to help me go to college, since I was a first-generation college student. So think about those people in your life. And now think about one or two words you would use to describe that person, how they acted with you, what your relationship was like with you. And would you share some of those in the chat? Those of you who are chatting with us. And if you see anything in there, so Tracy or Michelle, let me know. A positive relationship can be so powerful. Children learn how to interact and see life through their experiences in meaningful relationships. Each one of us has benefit from that in our own life, and we now have the opportunity to be that one caring person in another life. That's really the essence of the work that we do. Here are some examples of resiliency strategies that can occur in the school setting. School personnel play an important role in helping children recover from the difficult stresses of COVID and becoming more resilient. Social and emotional skills allow staff and students to support each other during this challenging time and grow from the experience. Social and emotional learning teaches students skills such as self-awareness, emotional regulation, flexible thinking, relationship building, and responsible decision-making. Developing these skills supports children's abilities to adapt during uncertain times. And that kind of leads me into some sharing I'd like to do around our school-based services. In response to the stress related to COVID, as well as the extended time outside of the school environment, we can expect to see significant changes in student behavior and increases in mental and behavioral health symptoms. We may see increases in crying, aggression, withdrawal, and hopelessness. We can anticipate increases in mental health symptoms and behavioral health concerns. During times of uncertainty, it is common for individuals to compensate by demonstrating behaviors that provide an increased sense of control. For some students, this may be demonstrated through externalizing behaviors such as refusal to attend school, participate in activities, defiance, or verbal and physical outbursts, behaviors that make them feel like they are in control. In addition to externalizing behaviors, students may demonstrate internalizing behaviors such as withdrawal, changes in sleeping and eating patterns, and increased physical complaints, headaches and stomach aches. This is something that school nurses can help to identify patterns in behavior. If there's a student that is coming to the nurse's office regularly, but there doesn't seem to be a true medical cause, that might be cause for to look at what else is going on. Compared to previous years, changes in student behavior may continue for a longer period of time and take longer to respond to interventions. This slide describes several of our best practice frameworks that were in development on the top line, a couple of funding sources and some of our infrastructure development on the second line, and an example of one of our most highly impactful programs. The School Wellness Initiative is a partnership with Miami University to create a model student assistance program for our K-12 schools. I'm going to speak a little more in detail with that in the next slide. The School Safety and Wellness Initiative is a partnership with Department of Education and Public Safety to create a strong statewide system to support schools and communities in their development of comprehensive approach to school safety and wellness. The Comprehensive School Suicide Prevention Program describes a set of school-based strategies aimed at preventing and addressing adolescent suicide at multiple levels. The Youth and Young Adult Early Intervention Framework is also being led by Miami University Center for School-Based Mental Health Programs. They're developing a framework and resources for families, schools, and primary care. All of these frameworks will include resources and technical assistance opportunities to assist with implementing these best practices. In the last budget season, Ohio invested $20 million in prevention education and professional development for educators. Nearly 400,000 students benefited from this work. 90% of Ohio school districts completed a self-assessment process to identify their organization's strengths and needs related to improving prevention services for students. And 86% developed and submitted plans of action to enhance prevention services in their schools. The 2021 budget also invested $675 million in wraparound supports for students that included mental health supports. This investment is repeated in the 22-23 school budget. We're in the process now of building a learning community between local ADAM boards and regional educational service centers to continue this support work and positive peer learning together. The bottom, PACS Tools, is a wonderful resource. PACS Tools for School at Home were developed to support families facilitating schools at home during COVID. This next slide gives you a little more detail on our School Wellness Initiative. It has three components. The first is the Student Assistance Program model that was based off of the Substance Abuse and Mental Health Services Administration guidance for student assistance. And the second is strengthening Tier 2 and 3, which are school terms for early intervention and individualized intensive interventions. And the third component is promoting mental wellness among school administrators and staff. We currently have around 80 schools participating in this pilot program. The Ohio's 133rd General Assembly enacted House Bill 123, the Safety and Violence Education Students Act, or SAVE Students Act, regarding school security and youth suicide awareness, education, and training. For the instruction required under this section, schools must use a training program approved by the Ohio Department of Education. Parents may opt their children out of the instruction. This slide describes the components of those educational pieces. The next slide shows current approved programs under the SAVE Act, and the Department of Education is working on a submission process for more programs to be added. It also gives examples of student-led violence prevention clubs that can be identified through the Act, the Save Promise Club, Ohio Adult Allies, and Ohio Youth-Led Prevention Network. With the heightened concerns around the impact of COVID on mental health and wellness in Ohio, children and youth, there has been an increase in readiness and need for the Sources of Strength program in Ohio. One of the things that has occurred, one of the positive things that has occurred during this period of time is that we've had an influx of additional federal dollars that have been targeted towards prevention efforts. And so we've been able to expand efforts like never before. Sources of Strength is one of those expansions that we have accomplished this year. Sources of Strength for middle and high school youth populations utilizes a team of adult advisors and youth peer leaders to promote help-seeking behaviors and develop connectivity. The team collaborates and creates campaigns that focus on building resilience through leveraging strengths. For grades 3 to 6, the elementary model is an evidence-informed universal curriculum that incorporates the protective factor framework for preventing bullying, substance use, violence, and suicide. Signs of Suicide is an evidence-based youth suicide prevention program that has demonstrated an improvement in students' knowledge and adaptive attitudes about suicide risk and depression. This is designed for grades 6 to 12 and teaches students how to identify those signs of depression and suicide in themselves and their peers. We are currently partnering with Ohio Suicide Prevention Foundation and Nationwide Children's Hospital to offer this program to Ohio schools. This program works really well with Sources of Strength as a complementary approach in schools. Now what I'd like to do is take a little deeper dive into suicide prevention strategies that we're using at OhioMHAS. It's important to have a comprehensive approach to suicide prevention that includes all of these components. We've talked a little bit about the life skills and resiliency skills and building connectedness between youth and adults. The other components are having ways to identify risk in children, increase help-seeking behaviors, provide effective care and treatment when needed, and care transitions and linkages. Having a way to respond when there has been a crisis and a way to wrap our arms around those communities that have experienced a suicide, and also reduce access to lethal means. Prior to COVID, our department completed, along with a long list of partners, the first state suicide prevention plan for Ohio. We worked with 30 public and private organizations now to implement the state suicide prevention plan for Ohio. There are monthly work groups tackling the goals outlined in the plan to expand education awareness, impact systems, build capacity, target high-risk populations, and use data to drive our priorities. The comprehensive school suicide prevention is important because efforts can be made within the school to protect adolescents from suicide, as well as to quickly detect warning signs and risk factors in adolescents who are suicidal. This comprehensive approach includes 3 components. The first one is primary prevention strategies. We've talked a little bit about some of those, but that includes policy, educating school faculty and staff on suicide warning signs, ensuring school faculty and staff collaboration and working together on this, including suicide prevention education, that peer assistance programming, and increasing that school connectedness. The second component of a comprehensive approach is the intervention component. And that is important to ensure student safety, assess students' risk, determine services needed when a student presents with risk, and making sure that they have appropriate care. The third component is developing a postvention plan that includes all those wraparound services needed after a suicide or attempt within a school community. All these resources can be available from our website. It has just a whole variety of walking schools through how to develop these programs within a school. I haven't talked much about coalitions, but coalitions are a real integral part of all of our work in prevention. In the suicide space, we have around 66 suicide prevention coalitions in 77 counties across the state. Excuse me. The Ohio Suicide Prevention Foundation, partnership with coalitions, has worked with a variety of partners, including Ohio University and PIRE, to provide training, technical assistance around best practices and how to use those best practices in their work as a coalition around suicide prevention. And these are some of the counties that participated in the most recent round of that work. The next thing I want to talk about is the suicide prevention campaign of Be Present. Be Present has an active following in social media and an online presence. This campaign was developed with feedback from youth and has had more than 1 million impressions on its social media posts in the last year. Sources of Strength works hand in hand with this campaign as well, and will provide the culture change needed to support students. This Be Present is a partnership with Nationwide Children's Hospital, and they are working on training to help young people become influencers, which will be help those school and youth-based prevention organizations carry sound messages forward. Suicide rates by young African-American men have increased by 73%. Black children under 13 are 2 times more likely to die by suicide compared to their white peers. Life is Better With You Here encourages those in the Black community to share their stories and start a conversation about mental health wellness. Our department worked with Department of Natural Resources to produce signs that are posted in state parks, since we know people may go there when feeling sad or depressed. We also developed messages for Ohio's farming community titled We've Got Your Back. It includes a website with outreach and resources for the farm community. Another strategy that we use is using gatekeeper trainings. Gatekeeper trainings teach people how to identify individuals who are showing warning signs of suicide risk and how to help these individuals get the services they need. Identifying and assisting individuals at risk for suicide is a key component of a comprehensive approach to preventing suicide. Friends, family, coworkers, and others can help if they know how to recognize and respond to the signs of suicide risk. We've offered these trainings to faith-based groups, Ohio Farm Bureau, 4-H Extension, schools, youth serving organizations, county commissioners, General Assembly staffers, workplaces, veteran and military serving organizations, and many more. We know suicide can be prevented, and we're laser focused on prevention work across age groups. So not only do we have our sources of strength and signs of suicide, but we also have the Zero Suicide Framework, which is a approach for the treatment side of suicide prevention. We currently have a SAMHSA grant, a national federal grant, that's serving 3 treatment agencies: Coleman Professional Services in Portage and Trumbull County, TCN Behavioral Health in Logan, Champaign, Greene, and Montgomery County, and Hopewell Health Center in Athens, Hocking, Benton, Jackson and Meigs. We are currently planning to roll out another Ohio Suicide Academy training as part of some of our federal dollars that we've received. And we also provide skills training for clinicians, including treating suicidality and Columbia Suicide Severity Rating Scale. The Ohio Zero Suicide Pediatric Initiative leverages resources through a public-private partnership, allowing hospitals to participate in a comprehensive training with a goal of disseminating information both throughout hospitals and into the communities. Next, I'd like to walk through some of our family and community supports that are available. We support something called the Maternal Depression Initiative, and that provides training on depression screening tools to providers and those working with pregnant and postpartum women. The focus is directed to increase screening and referral for maternal depression and available resources. We also have a fetal alcohol spectrum disorder process where we have a steering committee of state agencies, parents, stakeholders, and community members. They have a 5-year strategic plan that talks about education, promoting awareness, and developing strategies for sustainability. Over 2,300 participants attended the various FASD trainings in 2020. The Early Childhood Mental Health Initiative supports evidence-based training to equip parents and caregivers of young children with the skills to help their children develop into mentally healthy people. Parents and teachers who effectively nurture, support, and connect with young children, especially those experiencing social or emotional difficulty, can help improve or prevent future disabling problems. The Ohio Infant Mental Health Credential, launched in this administration, marking the first of its kind for a cross-sector multidisciplinary practice of promoting infant and child care mental health. The goal of this credential is to promote infant vitality, reduce infant mortality, and positive health and wellness outcomes. This slide has a smattering of other family and community supports I just want to touch on briefly. We have a partnership with Ohio Alliance of Boys and Girls Clubs to help them enhance and expand their evidence-based prevention strategies within their settings. We have the Strong Family Safe Communities project that engages local systems to identify community-driven solutions that highlight collaboration across agencies. This initiative is funded by Department of Developmental Disabilities and OhioMHAS. Healthy Transitions is also funded by Developmental Disabilities and OhioMHAS and supports transition-aged youth exiting foster care. Ohio Start is one that will probably be familiar to many of you, was specifically designed to improve outcomes for both parents and children affected by child maltreatment and parental substance use disorders. It's working to transform the system of care within and between child welfare agencies and substance abuse treatment providers and other family serving systems and agencies. To date, over 2,500 Ohioans have been served in 50 counties. OhioRISE is a specialized managed care program for youth with complex behavioral health and multi-system needs. Kids with the most complex multi-system needs require a very different type of care coordination. We recently launched the Ohio's Child and Adolescent Behavioral Center of Excellence, a partnership with Job and Family Services, Medicaid, Department of Youth Services, Developmental Disabilities, Department of Health, Family Children First, to support OhioRISE efforts to create new access to in-home and community-based services and support the provider community in those efforts. Another program that you're probably familiar with because it was birthed in the South, in Athens, through Hopewell Health Centers, is Handle with Care. This program gives teachers and schools the opportunity to provide needed support and care to students in the days following adverse traumatic experiences and monitor for ongoing needs. Engage 2.0 is a SAMHSA-funded system of care expansion program to implement and expand mobile response and stabilization services for children and families. It provides high fidelity wraparound and intensive service coordination for children and youth ages 0 to 21 with severe emotional disturbances. This program is currently expanding from initial sites in Southwest and Northwest Ohio. And MRSS will become a billable service with Medicaid in July of 2022. The Ohio Children of Incarcerated Parents program began in 2015. This program strengthens families and builds the reentry workforce capacity through a series of trainings conducted by certified reentry professionals. Project ECHO provides opportunities for local clinicians to present complex, real-life cases to panels of multidisciplinary experts and virtual learning communities, including discussions of the cases and written recommendations from the learning community. In addition to these, the Department of Education and OhioMHAS hosted a statewide trauma-informed practices conference for educators designed to grow trauma-informed care and staff wellness in schools. We've also begun conversations with the Ohio's pediatric physician community on potential collaboration and best practices. That gives you a smattering of programs there. Early intervention has become a really high priority for our department. And Miami University is also partnering with us on developing a framework for the state of Ohio that will include how to work these strategies within schools through the Ohio School Wellness Initiative. It will provide resources for families to help them have an easier road of identifying access to assistance. It will do the same kind of outreach for young adults and work with primary care physicians to, again, look at ways to help them route families to care that they need. We'll also look at screening as part of prevention strategies and helping to expand that within schools. The Ohio Adult Allies is a diverse network of adults who are committed to facilitating and advancing the work of youth-led programs. Regional Learning Collaborative leaders are adult allies dedicated to supporting other adults who enact youth-led programs. In the young adult college student space, several initiatives are underway. The Ohio College Initiative has been around for a good number of years, and it was established to reduce high-risk drinking and substance misuse. It has been expanded to include behavioral health and mental health. Prevention Action Alliance oversees the initiative. We have launched a new initiative this year with some of our new federal dollars called the Higher Education Behavioral Health and Wellness Initiative. This is an intensive program with a select number of schools to help them work on their relationships with the community and developing a promising practice approach within their higher ed community. NeoMed's Ohio Program for Campus Safety and Mental Health continues its work with a comprehensive approach to suicide prevention and mental health awareness in higher education institutions. And the Minimize Risk, Maximize Life Alcohol Awareness Program is being expanded. There are several public awareness campaigns to support these efforts. And Hey, I'm Here is a social marketing campaign created by and for young people to build an online community engaged in changing the conversation around mental wellness. The ABCs of Mental Health was developed and shared for the education community, but it's applicable to any audience. When COVID began to exact a toll on the mental health of Ohioans, we established the COVID Care Line for people to call and get immediate emotional support. Since then, counselors have fielded over 8,000 calls from all 88 Ohio counties. In March, the Ohio Psychiatric Physicians Foundation named the Ohio Care Line its 2021 Enlightenment Award winner and noted the service has been invaluable throughout the pandemic. The award recognizes outstanding activities, presentations, or publications which enhance the public's access to treatment and enhances the public's understanding of mental disorders. Of course, we still have our crisis text line that we put in all of our outreach materials. In July of 2022, 988 will become the national 3-digit dialing code for the National Suicide Prevention Lifeline, replacing the current phone number, which is an 800 number. Alongside a team of suicide prevention and crisis care providers from throughout the state, OhioMHAS is developing a clear roadmap to address coordination, capacity, funding, and communication surrounding the launch of 988. The OhioMHAS is collaborating with state leadership, suicide prevention experts, and persons with lived experience and others to create an implementation plan for this change. In order to take our prevention work to the next level and affect statewide change, OhioMHAS has begun the development of the Ohio Center of Excellence for Behavioral Health Prevention and Promotion. I'm happy to announce to this audience that the Ohio University Voinovich School of Leadership and Public Service was awarded on October 15th a competitive grant to coordinate the Center of Excellence. Working in conjunction with statewide and community-based prevention services practitioners, Ohio University will provide leadership, best practices, research, program development, training, and technical assistance across multiple focus areas and settings. This center will allow the capacity building needs of the prevention workforce to be coordinated into a centralized, consistent, culturally relevant approach that can be sustained and accessible to all Ohio communities. I believe this step will be a game changer for the state of Ohio for generations to come. In addition, the Ohio Suicide Prevention Foundation, in partnership with Prevention Action Alliance and the Ohio Center of Excellence for Behavioral Health Prevention and Promotion, will establish the Coalition Institute, targeting all Ohio's coalitions working to prevent mental, emotional, and behavioral health problems and community level trauma. We have a long history of coalition development that dates back over 30 years. This continues to be one of our highest priorities for investment that will impact systems change at the local level. The third exciting move for us is that we continue to improve the OES process and the availability of the data to local communities. And lastly, I wanted to point out that we have a crisis system task force that is meeting regularly to build out a crisis response system that's more readily seen and responsive to local needs for both children and adults. In order to ensure our children and youth are supported properly, we need to ensure that we are taking care of ourselves. In an airplane, in the case of an emergency, when oxygen is required, the instructions are for the adult to put the mask on themselves before helping a child to put his or her mask on. Right now, more than ever, we need this reminder. Right now, many of us are dealing with our own struggles. The question becomes, what do we do about it? Taking care of ourselves and finding ways to cope with the current struggles models these skills to those around us. I want to thank you for letting me be with you today, and I'm open for questions. I did a real fast run through of a variety of work that I thought might be interesting to you. And I'm sure that if you have questions about particular things I've shared, you can ask now or you can contact me. So I'll put my contact information up as well. So I guess I will turn it back over to Randy.
Yep, thank you,
Possibly.
Bobbie. Yeah, we do have a few minutes for questions. I don't know if anybody who's on remotely.
Randy, you think you're on mute?
Oh, I'm sorry. Again, thank you for tolerating an old guy who's not technology savvy. We do have a few minutes for questions. Anybody remotely, if they have questions, could maybe put them in the chat. And here, if you have a question, if you raise your hand, and then we've got, Tracy's got a microphone so we can repeat them so Bobbie can hear as well. Are there any questions or anything anybody like to bring up while we have a couple minutes? Yeah, we have way back there, Tracy.
A lot of agencies in the foster service system now are converting to qualified residential treatment programs, and I was wondering what the department was learning as people were adapting to that change.
myself. So that is, I know it's a new process, and I think must need Randy to mute. Yes, there we go. I know that's a new process, but that is one of the places that the new Center of Excellence will be monitoring that, and that will be the place. The new Center of Excellence will be monitoring that, and I'm sure that's where that learning will stem from. That's about the only answer I know right now, because I know it's all really new, but I know that's part of what the Center of Excellence will be doing.
Other questions? Anything anyone would like to bring up? Okay. Well, Bobbie, thank you so much. Oh, wait a minute. Bobbie, thank you so much for your time today. We really appreciate it. Just an incredible list of things that the department has going on. I've got several things I need to follow up with you about that I wasn't aware you were even doing. So thank you so much for getting us started. I should mention to the people who are here and online, we'll take about a 15-minute break now. So you can refill coffee. Just nobody take the last of it before I get to it, and have a chance to talk a little bit. We'll come back together, and then we've got a number of sessions through the day that'll be live here in the room, where there'll be a chance for dialogue and building on a lot of what Bobbie laid out in front of us and going forward. So we'll take about a 15-minute break, and we'll